Is the race against time, reaching herd immunity to the coronavirus through the vaccine as soon as possible as these new strains continue to emerge. President Joe Biden announcing just this week new efforts to ramp up vaccinations to 1.5 million per day. But is that enough? Tonight, McKenna King looking into that and taking that very question to a local doctor.
It should be the minimum that you do in a day.
All it takes is simple math. There are 330 million people in the United States.
Herd immunity, we think, is like 75, 80% of the population.
So achieving immunity at that level is going to require vaccination of nearly 250 million people as soon as possible.
Most of our vaccines are 2-dose vaccines, so that's 500 million doses.
As we set our sights toward ending the pandemic in 2021, Dr. Tang says we're going to have to shoot much higher.
3 to 5 million would be much preferable.
And time is of the essence. As new variants continue to emerge, each one more transmissible than the last, efforts to stop the spread get more difficult.
What we want to do is get ahead of those to make sure that we are both knocking down transmission with the tools we currently have, which is the public health measures, but then ramping up vaccination so we get people covered quicker.
So far, the Pfizer and Moderna vaccines are showing promise, even against the new mutations. But it's like playing with fire. Dr. Tang warning we need a national vaccination plan to help the states out when it comes to administering doses.
IT help to make sure that our websites don't crash when we try to make appointments, or more transparency when we talk about them telling the states 3 to 4 weeks in advance how many vaccine doses they can expect.
And if we can achieve the lofty efforts, he believes herd immunity by fall is attainable.